Over the last few years, there's been a lot of talk about diagnostics and how Africa is impacting diagnostics. The Frugal Diagnostic Network is a very important and relevant network because what it does is that it teaches us to be able to innovate using very limited resources. And that is things that Africa does not have.
Innovation doesn't just happen in the global north. It happens anywhere in the world. But together, clinicians, engineers, biologists, implementation scientists, we need to find ways to augment R&D capacity.
And the whole idea is to help brainstorm on the framework for identifying priority diagnostics for Africa, and also to start doing the prototyping on microfluidics, on lateral flow assay, and other different types of diagnostic elements.
This workshop has been such a wonderful opportunity for me, because I've been able to network and connect with people also working in the sector, focusing specifically on frugal diagnostics in different parts of the continent, from Zimbabwe to Malawi to Uganda. And it's really heartwarming to learn that there are lots of people still in this industry.
In Malawi, we have heavy disease burdens such as cholera, we have diarrhea, we have measles, and several diseases that need point of care diagnosis. And these frugal innovations can really help us in doing diagnosis cheaply, ready to use, and also rapidly.
The Global Frugal Diagnostic Network is trying to leverage the fantastic network of maker labs all around Africa and see how we can utilize these existing facilities to accelerate diagnostic R&D.
So far, I've been able to build some connections which I believe can be useful in the drafting of proposal and looking for grants to conduct research across Africa. So far, I will say this workshop has been very impactful, and I look forward to many more to come.
We are on the lookout for donors and funders to continue our activities in 2024 and 2025. Donate directly via Heroids Watts website or get in touch with us at frugaldx@gmail.com or frugaldx on X.